Welcome, everyone, to today's Ortho Panel webinar, The Tangible and Intangible Benefits of Expediting Patient Payments Through Technology for Orthopedic Practices. I'm Brian Zimmerman with Becker's. Thank you for joining us. So before we begin, I'm just going to walk through a few quick housekeeping instructions. Today's webinar will be a panel-style discussion. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is also being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. If at any time you have trouble with the audio or visual, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help out with that. And at this time, I would like to thank today's webinar sponsor, Rectangle Health, and tap on each of our panelists here to introduce themselves and share a little bit about their organization. Tina, why don't you get the ball rolling with those intros?
Hi, well, I work at Tennessee Orthopedic Clinics, and we are a division of Tennessee Orthopedic Alliance. TOC has about 30 orthopedics and a total of 64 providers with multiple ancillary services.
Excellent. Thank you so much, Tina. Thank you for being here. And Brian, with Raleigh Orthopedic Clinic, why don't you go next? We've got a few Brians on today, so gonna have to be direct.
All right, Brian Visa from Raleigh Orthopedic Clinic in Raleigh, North Carolina. I'm the CEO and Director of Ambulatory Surgical Services. We have 23 orthopedic surgeons, a podiatrist, 27 APPs. We see about 130 patients per year, and we do about 12,000 surgeries in our ASC. So pretty busy place. And we're the team docs for the Carolina Hurricanes, which hopefully will be in the playoffs coming up soon. NC State, Shaw, and the North Carolina Ballet. So pretty active community practice as well. We've been around for about 102 years.
Excellent. Well, thank you so much for being here and sharing that context. Andrew, why don't you go next?
I'm Andrew Lovewell. I'm the administrator and CEO of the Surgery Center at Clem Orthopedic Group and the Lodge at Keene Street. We have 26 orthopedic surgeons. We've been here about 65 years, non-operative and operative care in the market. And we see about 100,000 patients a year and do 8,000 surgeries at our surgery center and about another 6,000 at the hospital.
Excellent. Thank you, Andrew. And Brian Doyle with Rectangle, take us home here.
Thank you. My name is Brian Doyle, Vice President at Rectangle Health. First off, on behalf of Rectangle Health, I want to thank this amazing panelist for joining us and Becker's for putting on another great webinar. Rectangle Health, we've been around about 30 years or so. We are a premium leading patient payment engagement and compliance solutions company. We specialize in simplifying the business side of healthcare, specifically in the orthopedic PT realm. So I'm very excited about this topic because it plays into what we believe in at our core is automation and functionality to simplify the patient experience.
Thank you so much, Brian. And the first question I'm going to put to the panel, and Brian, maybe is really related to rising consumerism and costs and how that's manifested for them. But maybe we can tap on you first, Brian, with Rectangle, to sort of give your view of what you're seeing as far as emerging consumerism and rising costs. What are you seeing?
Yeah, absolutely. So let's define consumerism, right? Really, we need to access the patients where they are. So where are our patients and our clients, our providers? We're on our phones, we're on our computers, we're on our tablets. So we need modern technology that can access consumers or patients. I'm going to say consumer a lot because our consumers are our patients in healthcare. What we found is consumers and patients are driving the innovation. When we think about what they want and how they pay, think about Netflix, think about Amazon. Our cards are on file. We have subscriptions. I like OpenTable as an example. We book a reservation, yeah, card on file, come on in. Why don't we do that in healthcare? And we're getting there. We're absolutely getting there. But what we're finding is that consumers are shopping their experience now based off technology. How easy is it for me to make a payment? How easy is it for me to make an appointment? I want to come see you, but I don't really want to call anymore. I want to go to your website. I want to schedule an appointment. So we've seen this consumerism absolutely take off. It's been coming. And then, of course, COVID happened and it was inevitable. And now it's flooding the market, which is great. So really the biggest kind of learning curve we've seen on our end as the technology arm of this conversation is the consumers or the patients are driving it faster than the providers for probably one of the first times we've seen in a long time, which is really exciting. So by offering that technology, by offering that consumerism or modern ways to interact with your provider, we've seen increased patient loyalty, better patient experience, which all ends up to bottom line revenue for the provider.
Yeah, absolutely. And that sort of COVID has been an accelerant in a lot of ways for various trends. And this one has definitely taken off for sure. I appreciate Brian, you giving us a high level look at this trend. And now I want to dive into the specifics of how it's influencing the practices of all of the other folks on the line here. Andrew, how about you? Can you talk a bit about how these industry-wide trends like emerging consumerism and rising costs as well have really manifested at your organization, and really maybe share what you've done to adapt to these changes?
Yeah, so I think Brian did a really good job of defining consumerism in the healthcare arena that we work in today. And then I think the federal government took another step forward and said, there's this No Surprise Billing Act that has to be, where you're enabling patients with estimates within a certain time frame for cases or add-on cases. And it's not just for the facilities, it's all the entities providing the services for those patients. So it's, there's really a catch-22 there where some organizations scrambled to get that done. And then there were some that were more nimble that were ahead of the curve. They had technology, they had things in place to where they could do that. And they were a lot more digitally enabled to where they could, inform patients more proactively of what was going to happen with their care and what it was going to cost. And I think that was great that they did that, honestly, because being one of the few entities in our market that was doing that already, we were set, ready to go, and we had already been doing that for years with our patients. But it kind of leveled the playing field for those organizations that were ahead of others. But I also think, the big thing we've been able to do is created some upfront transparent bundles with patients for surgical care and non-surgical care, MRIs with an office visit, and advertise those on our website where patients know what to expect, how to shop around their care. It's a tab on our website where they can click on pricing and find out what it costs. We're out in the open about it. There's nothing to hide. I think that's kind of a freeing feeling. A lot of our surgeons were a little nervous to start with when we started doing that, but it gives you some easy breathing room when the federal government stepped in and said, you have to do this anyways. So it's just nice to know that we're headed in the right direction as well. So it's kind of my opinion on it.
And the truth will set you free, right? Andrew, I'm wondering if you can tell. So you've been doing that work for years, sort of the price transparency piece. Can you just talk a little bit about what that work actually looked like, and maybe what the impetus was for you guys to do that, to offer that to your patients before the federal government sort of mandated it?
Sure. So we are in a market where there's a dichotomy of orthopedic services. So we're the only private group within a large radius, and then there's an academic institution in our market as well. And we compete over really the same geographic, catchment area, but what we don't compete on is price and value. And we know that because we know how much more valuable ambulatory surgery care is, or outpatient MRIs, or virtual care can be. And our patients have learned that too during COVID. So I think for us, we were able to kind of have another value add when we started advertising our pricing and telling people up front, hey, if you come in and see us for an office visit and an MRI, or an office visit and an X-ray, or you want to have your ACL done or your total knee done, like, here's the price, And I think a lot of people were kind of shocked by that. I know our competitors were. They're like, how can they do that? Like, how do you even do that? And for us, we're nimble enough and small enough that we can pivot and make those decisions, but we also knew that there was going to be power in having transparency and information available to the general population or our patients. So we had to get downstream provider agreements with our anesthesia, with our implant vendors, with the lab, pathology, all those ancillary services that happen at your surgery center or happen with your group, and just be able to be upfront, with those people to say, listen, we're going to post this on a website and you're going to get paid X and you're going to have to be agreeable to X. And if you're not, sorry. But we want these patients, you want these patients, it's good for everybody. Let's just make sure that we can be dominant in the market with this. And, when this comes out and is a mandate, which it was talked about, and then they enacted it, we were so far ahead that we're like, yep, we're very comfortable.
Thank you for diving in a bit deeper there, Andrew. Appreciate that. Brian Bizzub, now let's turn to you. Can you talk about how trends like consumerism, rising costs have really manifested at your organization? What you've done to really adapt to these changes?
Yeah, I think it depends upon your demographics, but we have a very diverse population, and they're the ones demanding it. They're coming to us saying, "Why don't you have this technology? My vet does. My dentist does. Why don't you?" So, we really took a real hard look at the organization and said, "Okay, how do we make the patient experience better?" So looking at online appointments, we all make online appointments every single day for every other service except healthcare. Payments, we expect patients to come in and we're trying to reconcile to pieces of paper rather than having a report that is just uploaded and the journal entries jump right into your accounting system. So there's a lot of cost savings, as well as patient efficiencies. So, and with high deductibles and having 2 surgery centers, the reality of it is I'm collecting $3,000 to $8,000 from a patient because they have an HSA plan and not a PPO plan, and having difficulty making that happen. So having automated payments, you can do the good faith estimate. The patient can then click a link and pay their bill and or get financing based upon the company that you link up with. So we're seeing more patients. So we're opening our doors to many more patients a lot faster than some of our competitors. So I think the technology is going to drive our industry much more, a lot faster than it has in the past 2 decades. Patients needed us 20 years ago. We now need patients. So we need to stay up with the technology to keep them coming through the door.
Thank you so much, Brian. I definitely want to dig deeper on sort of that payment option, the easy payment option that you've presented to your patients, and how successful that's been, what impact it's had. So we'll definitely get back to that. But I want to bring Tina into the conversation now on this piece on these trends.
Sure, to touch on Brian and Andrew's points, price transparency, making sure that patients we have the new technologies that they expect is so important. Keeping up with our patients' expectations from a technology perspective is our biggest challenge. Just trying to look at the high rising costs and the patients' higher deductibles. Some things we have done also, in addition to the ones that we've already spoken about, is we've offered more services like quick care to keep them out of the emergency rooms. And of course, we've talked about telehealth and how important that is. To me, the biggest piece of this is going to be price transparency. We are actually in the process of rolling that out, and also giving our patients every opportunity to pay us, whether that's online or text messaging or online chat, and then or QR codes on the statements, and giving them credit cards or bank alternatives to pay us up front. That is just so important to make sure we are keeping up with our patients' expectations.
Thank you so much, Tina. And I think the question I'm going to go ahead and jump to, and maybe we'll come back to a couple of the other ones, but can you just talk about, when your organization, Tina, and Brian, I want to get to you on this too, made the transition to a digital payment solution, online payments, text to pay, all that kind of stuff. Why was that an area of focus specifically, and what were some of the pain points? Tina, we'll start with you.
Well, I think the online payments were probably the easiest. We started in 2017, and we actually changed to another vendor in 2019 that would actually integrate with our practice management service system, because once you got the online payments, you were manually going in, printing them out, and that was a huge pain point. It was just a double manual process, causing more staff time. But now that we have the integration and it automatically goes into our practice management, it's just a smooth transition overall. Some other things, as far as we have online chat, and that gives our patients the ability to get questions answered timely, not leaving voicemails and getting answers back. And then we can collect those payments quite quickly we'll give them a call or whatever. So just making sure that we have credit card on files, we're doing online payments. And then even statements, with the orthopedic population and depending on your specialty within orthopedics, some of your patients are older and are not going to respond to a text message and they still want those statements. So make sure that we're doing the QR codes if they can understand that and making sure that they get that technology that they need that can meet every age and every expectation and just that whole generational need and making sure we get those payments in the door.
Appreciate that, Tina. And Brian, as I mentioned, Brian Bishop, let's come back to you. And you sort of mentioned this, the importance of this payment solution for you. Can you talk about why it was such an area of focus for your organization, and maybe even maybe some of the pain points you encountered when rolling this out?
Right. Again, I think, like Tina stated, a lot was very manual, very paper oriented, long merchant reports that you had to balance on a day-to-day basis. So moving to a more digital platform, it's really been extremely helpful, but we did have our challenges. Patients did not want to give us their credit cards because in 2017, victim identity was a huge thing. So people were afraid to do it, although they would log on to Netflix and type it in and not think anything about it. But in healthcare, it was like, oh no, you're going to steal all my information. So I think that was one of the biggest challenges that we faced, and then interfacing with EMRs. So I think a lot of companies, they can provide the report and you can do the balancing, but it's still a relatively manual process. I think we're looking now at a vendor that interfaces directly into our financial system or into our practice management system that just automatically aligns the payment with the line item charge so that we're not having extra staff balancing every single day. So having the ability to balance, meet the patient needs. Staff education hasn't been really of an issue. One of the other pain points that I have had is identifying the correct partner, right? Because there are a number of companies out there that do this, but the reality of it is a lot of them were very big box companies and they offered everything. And it was fine until you had a question or your practice did something a little different than the practice down the road and you couldn't get anyone on the phone. They couldn't figure it out. They didn't really care. All they wanted was your fee. Where working with, I think that's the biggest thing that in looking at a digital platform is understanding the vendor, understanding a relationship rather than just being a vendor. That's my biggest issue with this whole process is with scheduling, with digital payments, it's knowing who you're doing business with, and that makes a big difference.
Right. I appreciate that, Brian. And I want to ask a follow-up there around sort of getting over that pain point in terms of getting that patient trust with getting credit cards on file and things like that. How did you sort of get over that hurdle? How did you communicate to patients? How did you do that?
Yeah, so we really tried to educate them to the idea of encryption, that we didn't really keep their credit card, that we only could see 3 or 4 numbers. The other thing that really made the biggest difference is if you have a refund, and in the ambulatory surgery center, and when you have both the practice and a surgery center, typically one person gets overpaid and the other person gets underpaid. We were able to refund patients within a few days, if not the same day. Unlike old systems where it would take 3 months before you got your $5,000 back, I could actually tell patients, oh, you'll see that on your credit card statement this afternoon if I have your credit card on file. And that was like magic words to them. They were like, oh, okay, here's my credit card. The other thing was in physical therapy, because obviously patients come 3 times a week, and it's quite annoying to be asked for your credit card 3 times a week. So for 8 weeks in a row. So patients just eventually gave in and said, okay, here's my credit card because I have other things to do than to stand here and wait for you to process everything.
The convenience of it sort of won out.
Yes.
It's just sort of it becomes a no-brainer at some point.
Yeah.
Appreciate that. Andrew, I want to turn to you now and sort of see if you can talk a little bit about when your organization made a transition to a digital payment solution and any pain points you experienced or anything you'd like to share on that. And then Brian Doyle, of course, I want to hear from you on this as well.
So we started taking credit card payments digitally with a solution back in 2014, a little early to the game, which came with a lot of major pain points, honestly. So we had the same issues that Brian and Tina did. We had to download these complex reports, and then you had to try to, match them up with what was in the system, and patients could put their own name in there, and it didn't match what we had in our system. So then we're like, okay, is this person really this person, or is it that person? And it didn't, it wasn't ideal, but we thought it was important to offer it. So we switched vendors as well around the 2017-18 mark. And, the vendor we switched to was good. I wouldn't say they were great. We just recently switched again to a new vendor that works with our PM system, does auto posting to the account. It does auto refunds that we approve as well back to the credit card. So it works pretty well, kind of like what Brian said. You're able to get the money back to them faster if there is a refund, which I think patients love because they're not waiting on a check to be cut somewhere, and like, where's my money coming from? I overpaid you. My EOB says this. So it's a lot easier to have that conversation with patients and say, we can put this right back on your credit card or your HSA or whatever immediately. So that's a game changer. We have a text solution as well that patients get a text on, to pay us, their deductible or copay or whatever they're going to have, for their surgery. But I think the biggest pain point early on was just the adoption rate of patients trusting the systems to put their information in there was pretty low. And then when they got their information in there, not knowing how we were going to true that up was a huge problem. So being able to get a new solution that has their account number preloaded, all their information preloaded, they're just going in, they can monitor it on their phone, they get a receipt on their phone. Like it makes a huge difference, as opposed to where we started. And I think that's just the evolution of technology. And it's just added more security to patients knowing and being in much more control of, their own financial livelihood with a credit card or debit card or whatever, like on an automatic payment plan or on, if they're set up to just have a one-time payment and being able to change that credit card or do something differently. I think it's been huge today.
Thank you, Andrew. And a lot of common themes here, sort of patient hesitancy around this, and then sort of also the technology evolution and really looking for that right partner. Brian, I want to give the floor to you now to speak on what you've heard.
Yeah, first of all, everything that I just heard is music to my ears because that's what we're hoping every provider is doing. So that's amazing. Couple things I'll touch on, I'll kind of piggyback off all three panelists, is vendor management is critical. There are actually today, there's so many options that it's almost overwhelming. You can choose 3, 4, 5, 6 different vendors to do everything the panelists just said. One to do our texting, one to do our financing, one to do our statements, one to do text to pay. It becomes actually more burdensome, even though the technology is really great. Vendor management becomes an issue. So I think Brian mentioned it. It's about finding a partner. Can the solution you're offering do all of this in one central platform? Yes, it needs to integrate. Yes, it needs to be compliant. Of course, everything needs to be encrypted and secure. But does it make our staff, our FTE's life easier too? Yeah, we want to make the patient life easier, and technology is readily available to do that. But we also need the FTEs to be happy. So what we've seen a lot of is almost too many vendors in place. So we strongly believe in consolidation and centralization of vendors and platforms and building out partnerships. And then recurring payments for PT specifically has been just a rocket ship of user adoption. I use personal experience a lot. I go to PT because I've had a few knee surgeries in my day. I usually go at like 6 a.m. It's just the PT and myself. But by the time I get home at 8, hey, Brian, your credit card was charged. Here's your receipt. It's just automated every single time because the FTE doesn't come in until roughly 8:15. So things like card on file, things like recurring payments, things like third-party financing. all of that is readily available. It's about finding the right vendor that can do all of the above. So it's a really cool thing, technology, but it can be overbearing if leveraging too many vendors.
Appreciate that, Brian. And I want to get to sort of some of the specific benefits these solutions have yielded for the practices of folks on the screen. But Brian Doyle, I want to just tee up a question for you, sort of inspired by the first question we asked around sort of the rise of consumerism and that. And a big part of meeting the consumer expectations is a good financial experience. So I just want to tee up this question for you. How important would you say easy payment options are to supporting a better patient financial experience?
Yeah, I think it's the number one most important thing a provider can do. The study that really blew us out of the water is there's a direct correlation between the patient billing experience and revenue. So if I have a bad billing experience, I'm not going to pay. If I get a paper statement for $20 and I can't scan a QR code, Tina, which by the way, amazing job, that's awesome. If I can't scan a QR code and I have to call into the practice, I'm never going to pay that bill, and I'm a good payer. I want to pay my bill. It just gets left on the wayside. So in what we're seeing, and every data point backs this up at this point, vast majority of patients want card on file. It's like in the high 60% range. Patients want recurring payments. That's almost in the 70% range. Text to pay is a 98% open rate. There's a reason these numbers are what they are. It's because consumers, our patients, are mandating that we have these procedures in place, or they'll shop their healthcare experience. So to me, Brian, it's the number one most critical thing we could do as a provider. In terms of payments, of course, in terms of patient.
Right. Right. And I think it makes a lot of sense. I can't tell you how many times I've gone to purchase something online, and if it didn't have an automated payment option, and it asked me to enter out my info, then I'm immediately like, I'll do it later.
Yeah.
Just like right away. Versus if I have that immediate option, I'm paying right there. I'm buying the thing. It makes a lot of sense.
Yeah, absolutely.
Tina, I want to come back to you now and wonder if you could get into the specifics a bit about the benefits your organization experienced as a result of really implementing this patient payment technology. Thinking here about operational efficiencies, any increased collections or its effect on staff too. I think Brian mentioned that it can be a positive experience for them as well. So anything you can share there, Tina?
Yeah, basically, I mean, from our patient experience, just like Brian alluded to, if your billing cycle to your patient goes wrong, it is not good. I mean, they're mad at the entire organization. So making sure that our patients can access, or they can even access their statement via portal to verify their balances if they want. We also have a solution for patient estimation, so they kind of know what their surgery is going to cost for those that have healthcare insurance, but higher deductibles. But just going back to the fact that our employees now have these tools in front of them to inform the patient of what their responsibility is going to be, inform the patient of the ways that they can make their payments where they're not having to take time of getting a statement out of the mail and trying to mail in a check or call our office. You know, that we have these automated technologies in place that that will save not only staff time, but they save our patients time. And I think we all know we never have enough time anymore. And so we have to make sure we're as efficient as we can. Have there been cost reductions? I think the way I would look at it, if you're looking at it as a percentage, yes. But if you're looking at, we've had increased payments, so it brings down that cost reduction. So it's a percentage, right? So, but you know, overall, just looking at increased collections, significant when you go to an automated technology for many, many reasons, alluding to what's already been said.
Appreciate that, Tina. And I definitely want to dig in deeper on sort of the patient financial conversation component of this in a little bit. But Brian, Bizza, let's get to you and hear about any benefits your organization has sort of experienced from this technology.
Yeah, no, I think the patient engagement piece, I agree with Tina. I mean, electronic statements, it's easy to click a button and pay your bill. Just like Brian said, it's not something I'm going to probably do if I can't do it right then and there. It's like making a doctor's appointment. I do it in the car from one office to the next. And if I have to call somebody and talk to somebody, I'll probably hang up. I'll get in the loop, and then I'll never get it done, and I'll never get the appointment made. What we've seen is patient satisfaction has increased. The ability to make a payment plan very easy. In the past, it was very difficult. There were a lot of signatures. And when you have a surgery center, that it's a big numbers. So you want to capture that right up front. So we've increased our collections at time of service. We've been able to collect co-insurances at time of service. We've been able to use to send education to the patient. So there's a lot of advantages to being on a digital platform. The costs, like Tina said, the more you bring in, the more you pay. But I think from an employee standpoint, they're much more satisfied because they don't have to have those conversations. And, we used to role play with employees to, for those challenging conversations. And we still do that to a certain extent, just to make sure that they're ready to be able to answer it. But if you can click on a button and look at your EOB and see what the patient responsibility is, it's done. You don't have to go anywhere else. Your insurance company is telling us that you owe us $187. Would you like to pay it now? It's just keeping them engaged from the get-go rather than 30 days later or 45 days later when the paper statements go out and they get the statement, then they try to call. And again, if they don't get through to the CBO, they're probably not going to pay the bill. They're just not going to write a check and send it in. Everyone has a question. So we'd much rather have the questions real time than after the fact.
And I imagine that just getting rid of some of the trickiness around some of those staff conversations around the financial obligations is a real staff satisfier. I can imagine those conversations sometimes are not that fun to have.
Yeah, and it engages usually the entire waiting room. So, it's not just one person. It's usually, and then everyone else questions what's going on. So it can be a lot of fun.
Right. Andrew, I want to come to you now and see if you can share any benefits your organization has experienced as a result of some of this technology.
Well, I think echoing what Brian and Tina said, the biggest thing is from my perspective, it removes some of that awkwardness, when the staff's calling the patient going, hey, by the way, your copay is this and your deductible is this. And especially at an ASC, like we're going to eat a big chunk of that up. And that's just the cost of us having surgeries and doing business here. So, my staff, they used to call and go, hey, by the way, your copay and deductible and your out-of-pocket max is this, and you're going to owe us $8,700. And people get that like shock and awe factor of like, oh my gosh, what just happened? But when it's a text message, I mean, for better or worse, that text message is the bad person, right? That's the bad thing that's sent it, not the staff member picking the phone up calling. It's the text message, because then the staff can go, oh, I know you got that text message and I'm real sorry about that, but let's talk about payment plan options. So I think they can be the good person then and blame the text message for being the bad person. But the number of patients that set up a payment plan through the text, it's incredible. I was kind of blown away when we started doing that. And then, now my staff are like, oh my God, thank you so much. I don't have to be that bad guy asking them for all this money. And then like Brian said, you're not engaging the whole waiting room day of surgery and them going, what the heck, I agreed to pay this. Like it's all ironed out way ahead of time. Everyone's comfortable. Everyone's moving forward in the same direction. Like there's not this threatening conversation of back and forth, like we need your money or we won't do surgery type of thing.
Thank you, Andrew. And Brian Doyle, I want to get to you in just a moment here, but since we've transitioned to sort of really talking about how this influences staff, having these financial conversations, Tina, I want to give you an opportunity to share even a little bit more maybe about how your organization is approaching those conversations and how this technology has helped in that area.
Well, some of those conversations no longer have to occur, like Andrew said, which is awesome, unless there is a significant payment amount due, and then they'll have to set up that pay plan. But of course, we have the training and HIPAA compliance, making sure that it's done within the regulations. And scripting, we use a lot of scripting, and then just making sure we have technology even our technology has scripting in it that gives them the ability to have that right conversation. A lot of people do not feel comfortable talking to someone about collecting money. So we have to give them every opportunity not to have that conversation through automation. As what our goal is. But that's kind of what the things we do here is mainly just training, scripting. When those, we can't 100% not have those conversations. It's not going to happen. We're going to have some of them. But if we can just get everything automated as much as possible where we don't have to have those conversations, that would be our goal as far as patient payments. So.
Thank you, Tina. And Brian Doyle, want to throw it to you now to talk a bit about what you've heard as far as these benefits and any additional thoughts.
Yeah, absolutely. So I think we had a third-party firm come out and kind of ask these questions to our partners, and Tina just nailed it. It was, we don't want to have the awkward conversation of, you owe us $5,000. How would you like to pay that? And Brian and Andrew echoed, that usually happens in the waiting room, and it's usually not great. So what we've seen is by automation, by technology, we've seen a number of stats that were pretty shocking. An improved collection rate at the time of service or time of care by anywhere from 5 to 13%. That's a huge number. We've seen a reduction of AR by about 20%. And then the next two were really good to hear, is a reduction of paper statements by 33%. And we all know that paper statements, it's a waste of time and money, in my humble opinion. Obviously, I work for a software company, so but they're expensive, and on average, it takes 3 or 4 paper statements to get one payment back. They're expensive. And then 25% reduction of calls to the practice. So we could take the FTE hours and allocate 25% of their time to doing what they're there to do, which is take care of the patients, instead of fielding calls about, hey, I have to pay you, or I don't understand what my statement says, or what have you. By automation, we've seen just a dramatic change in the patient and the provider experience, all for the positive.
That definitely tracks with what we've heard so far. And Andrew, how Andrew put it as well, is like that text message gets to be the bad cop.
Yeah.
And you get to be the human being gets to be the person that commiserates with you. I know that's going to be hard. Here's the payment plan. I want to get to then just any other work folks are doing to really improve the patient financial experience, or any benefits or anything we haven't touched on related to the automated payment technology that you think is important to note. Brian Bishop, let's start with you here.
Well, I think, just having the platform to be able to have the conversation with the patients prior is really essential. Like, to be able to have a conversation after, like Andrew said, the bad guy text, it's a much better experience. So it ends up changing the patient satisfaction with the practice, the employee satisfaction with the employer, because it gives them the opportunity to help the patient and not be all about money. We're not about money. We're about healthcare and providing healthcare, but there is a cost to it, like Andrew said, and they have to pay it. And we just want them to be able to have the opportunity to look at financing, contact family members if they don't have the money, move it around from fund to fund, whatever the case may be, before the phone call happens. Because once I get the text message, I'm now trying to figure out, how am I going to pay this bill? So before I actually call the practice and have the conversation. So I think it's being engaged with the patient. Again, it's patient engagement. It's keeping them engaged in healthcare, being able to look at it on their phone. We do everything. I mean, half of the internet purchasing I buy is on my phone, not on my computer, right? So if I can't do it, like if I can't double click Apple Pay, I'm probably swiping up and going, I'll do this later, just like you said, Brian. I think it's the same way. And healthcare is like the last industry to adopt technology. We are always like 20 years behind. Andrew apparently was not, but we definitely were. So I think it's been a pleasure being able to bring some of this stuff, a little painful along the way, but getting away from paper, getting away from reconciliation on a day-to-day basis, frantically running around at month end trying to make sure where's the 10 cents that we missed. It's been a big change in healthcare. It's been a big change in how my day runs every single day. So, and the chief operating officer and the central billing officer. So I think it's at every level of the organization, from patient to, the central billing office. So it's a big deal.
Yeah, thank you so much. And Andrew, Tina, I want to hear from you as well on this, and then Brian Doyle, we'll throw to you on some closing thoughts. But Brian Bishop, I want to ask just a follow up here, which is out of my own curiosity, honestly. Whereas you said this technology has been so slow to come to healthcare. Any thoughts on why that is?
I think we just we're less trusting. I think we're not a big self-pay business. We're not used to collecting cash other than copays until recently, when HSAs became $25,000 deductibles. We always chase the money, right?
Mm-hmm.
So the dentists and the vets, they're self-pay business, so they got this up and running much faster, because when I go to a vet, I know it's going to cost me. Here's my credit card. When I go to the doctor, I don't expect to pay anything. And in North Carolina, there's still about 30% of the people that live in the state that believe the same thing, that they shouldn't collect, they shouldn't have to pay anything the day of service. So having the ability to just kind of get to them before they get here, they're aware that there is going to be some financial obligation, most likely. If they're lucky, there's not, but most likely they're going to have to pay. So I think that's what caused the late kind of adoption. Is we had insurance plans that actually paid most of the bill, if not all of the bill.
Yeah, that makes sense. I appreciate that. Andrew, I want to throw to you now. Any other benefits you can share? Any other work you're doing to improve the patient financial experience? Any closing thoughts at all?
I think, we were early to the game as far as online digital payment plans, but what we've struggled with, honestly, has been online digital scheduling and paying your copay ahead of time before walking in the door. That's been a challenge for us, because my surgeons have this feeling that, well, if I have a patient scheduling their appointment in my schedule, I don't have any control over that. Well, you don't. You're right. Get over it. If you want to see people, you're going to have to agree to see them when they want to be seen. So that's a huge challenge for us. We're not there yet, to tell you the truth. But I think to Brian's point, why the uptick in technology has been slow in healthcare is we have so many entities or hands in the pot that keep stirring things around, like commercial insurance and Medicare and VA plans and all these things, where there's just an added layer of complexity. And I think for a long time, patients just had this expectation that I have insurance, it's covered, right? Well, unfortunately, that's not the case anymore. And, we're the only industry where, and when I have patients who are like, I don't want to pay anything, I'm like, okay, well, let's change your oil here instead. Would you pay me to change your oil ahead of time? Well, yeah. Okay, well, then you're going to pay to get your total knee replaced ahead of time. Like, it's the same thing. You can't compare these two huge, vastly different industries and say, well, I'm not going to pay you. So, because we all know that there are patients who aren't going to pay the bill. And, unfortunately, that's what collection agencies exist for. We don't want to do that. That's not a business that we want to do, is turn our patients over to collection agencies. But we also have a cost of doing business, and we want to get covered and at least, break even or make a little bit of money on healthcare. But it's the weirdest industry to be in, because I feel like there's this sense of or maybe a misunderstanding, or just just the healthcare literacy of understanding what insurance really means today is not what it meant a long time ago. And what insurance is today does not mean you're necessarily covered, because there's pre-existing conditions still. There's all these things that fall into policies where patients, unfortunately, just don't understand their coverage. And then, you can have the text message be the bad guy, but sometimes that's not even good enough. Sometimes you're still sitting there with patients trying to explain to them, well, you have this open marketplace policy and it's pre-existing for this, and you saw the doctor 5 years ago and now you can't get your knee replaced because you have this. And those aren't fun conversations. They're necessary, but I think it's always important to make sure that the patient's well informed ahead of anything major, to make sure that there's this expectation setting process to where there's never ill feelings at the end of something. That's our goal here, is that I don't want a patient to get upset and get on Yelp or Google or something and go, those people didn't tell me anything. So that's the big thing for me.
Yeah, you're not the one blindsiding them around with these costs and stuff like that. Appreciate that, Andrew. And Tina, I want to throw to you now too to talk about any benefits we maybe didn't get to. Any thoughts on the patient financial experience you didn't get to share? Any closing comments at all?
Sure, just along the lines of why we've made this shift. If you'll remember, I think HSAs were introduced around 2004, but they really started taking off in 2014. And we saw this huge shift of patient responsibility over the last 8 years. And so healthcare had to scramble to react, because no longer is, right now we have like one insurance company that is our highest payer. But our patients, as collaboratively together, all together, they're our second highest payer. So we have to give our patients every mechanism to pay us. Whether that's through text messaging or online payments. We shame on us if we're not. We really need to give them every opportunity to pay us. They're going to have a better patient experience. I think the challenges keeping up with making sure compliance, data leaks, making sure you don't have to worry about that, and making sure you choose the right vendor that covers that. And some of the other challenges are just keeping up with them, keeping up with what everyone else is doing, and making sure that we give them opportunities to pay. And I think they appreciate that, definitely. So.
Thank you so much, Tina. Brian Doyle, throwing it to you now for any closing comments you'd like to make.
Yeah, thank you. And Tina just kind of set me up there, as that's where I was going. Is the last 30 years, healthcare has been chasing insurance to get paid because it was $5, $10, $15 copays. So, all right, we miss a few copays, not the end of the world. Patient pays 36% of healthcare revenue right now. That is a massive number. So we can no longer not collect 36% of revenue nationally, right? So the technology had to catch up to what deductibles are up, premiums are up, copays are up. It's $50, $75, $100 a pop now. So the numbers just dictate that technology has to catch up. So in wrapping all that up, is there are a lot of good vendors out there. There's a lot of good software out there. I would strongly encourage everyone to talk to 2, 3, 4, 5 different vendors and see what works for you. This should be a partnership relationship. A vendor should be able to scale either up, down, consolidate, spread, based off what you're asking them to do. That all return, or the ROI on that, is palpable, whether it's collection rate, FTE hours, reduced AR, reduced paper statements, improved patient satisfaction. That ROI is, you can model that ROI and get that back in very short order once technology is implemented.
Thank you, Brian. It's certainly a common theme throughout the conversation, really finding that right vendor partner. It really has been a pleasure speaking with all of you. I want to thank you, Tina, Brian Bizup, Andrew, Brian Doyle, and of course, Rectangle Health for helping Becker's put on this webinar. And for everyone out there, to learn more about the content presented today, you can check out the resources section on your webinar console. And you can also you can fill out the post-webinar survey. We appreciate that very much. Thank you for joining us today. We hope you have a wonderful afternoon.
Thank you.